Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. Federal government vaccinates religious leaders, solicits their help to mobilize residents for vaccination exercise. Yobe State government begins vaccination rollout amid vaccine hesitancy by some residents. And Germany reports highest increase in COVID-19 infections in 2 months amid vaccination challenges. From the Nigeria Center for Disease Control (NCDC), 135 new infections were recorded on Thursday. The fresh infections were reported in 16 states, including the Federal Capital Territory. 40 cases were recorded in Lagos, the epicenter of the pandemic, followed by Imo with 20 cases and 14 in Ogun. Other states that reported new cases are the FCT 10, Kebbi, Rivers, Akwa Ibom, Plateau, Ebonyi, Kaduna, Kano, Osun, Oyo, Ekiti, Gombe, and Nasarawa states. According to the center, the infections in Kebbi State were recorded over the last 2 days. However, 426 recoveries were made, including 162 community recoveries in Ebonyi State, managed in line with the guidelines. No new death was reported yesterday. A total of 12,429 are active cases across the country. In the meantime, over 400 million COVID-19 jabs have been administered globally, with about 95 million people who have been fully vaccinated. The top 5 countries driving those numbers include Israel, followed by the UAE, Chile, the United Kingdom, and the United States, according to World Meter. Now, the WHO, while saying that some countries have received vaccines through the COVAX initiative, bilateral deals and donations, 38 African countries have received more than 25 million doses of COVID-19 vaccines. And it says that 30 have started vaccination campaigns. Back in Nigeria, the federal government says it will begin vaccination of religious and traditional leaders to boost the confidence of the public in accepting the COVID-19 vaccines. It reassures that the Oxford AstraZeneca vaccine is safe and has no adverse side effects. At a one-day sensitization for Muslim scholars and imams organized by the National Primary Healthcare Development Agency in Abuja, the President General of the Nigerian Supreme Council of Islamic Affairs says although the council has endorsed the vaccines, it will not force anyone to take it. Our correspondent, Emperor Simon, reports.
It's the second time the National Primary Healthcare Development Agency is meeting Muslim scholars and imams over the vaccination exercise for COVID-19 vaccine. This time, it's to clear the air around the safety of the vaccines.
The European Medicines Agency clearly finalized their investigation and came out with a report yesterday that it is safe to take AstraZeneca and that there has been no cause and effect relationship between vaccination with AstraZeneca and the blood clotting disorders.
We are gathered here today to reassure ourselves and to reassure the public that the vaccine we have been using is safe and useful.
Then, the President General of the Nigerian Supreme Council of Islamic Affairs speaks on the council's support for the vaccine. However, there is a caveat.
Like I said in my last opening remarks, it's left for you to want to take the vaccine. Because we will not force you, in the sense that when you're hiding in your house, it will not even come to your house, we won't see you. We only advise you, we only try to appeal to you, like we did with the polio vaccine decades ago, and today we are polio-free.
Chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, however, announces the commencement of vaccination for religious and traditional leaders.
Let me assure His Eminence, the Sultan of Sokoto, that we are working on getting all political and strategic leadership to take the vaccines, and that includes our religious leaders and traditional institutions. Therefore, I commend it to all eligible Nigerians to do so that we can be protected from this virus.
Since taking delivery of the Oxford AstraZeneca vaccines in March, Nigerians have been asking questions on the genuineness and effectiveness of the vaccines. Some are asking if it can change one's DNA or whether there are adverse effects from the vaccines. These are questions that the government hopes that this meeting with traditional and religious leaders would address. Emperor Simon, Channels Television News.
While vaccine hesitancy persists across the globe for one reason or the other, in Yobe State, some residents have voiced similar concerns. Our correspondent who spoke to residents in Damaturu, the state capital, revealed that the state government may need extra efforts to sensitize local government areas on the significance of accepting the Oxford AstraZeneca COVID-19 vaccine to stem the spread of the disease.
Yobe State recorded its first COVID-19 case on April 30, 2020, and since then has been one of the states with the lowest number of confirmed cases in Nigeria. As at March 18, 2021, the state had a total of 293 confirmed cases with 9 deaths. Although the state has reportedly received 61,630 doses of the COVID-19 vaccine, it has not officially launched the rollout. Recent controversies surrounding the AstraZeneca vaccine has left some residents skeptical.
You take some drugs and they tell you that they've tested it for quite a long time and this is it, but this one immediately it has been released. And not only that, recently we've heard of blood clotting and what have you, and then all of a sudden they said, no, this one has already been cleared. And so that is one reason that I said, no, I am for now skeptical.
To others, it's a welcome development that all Nigerians should embrace.
I have to believe in the science. The only explanation one can give for not receiving it, I don't think there's any genuine explanation for not receiving it. These are experts. It's something that is being developed by experts, so I have no reason not to accept it.
In the meantime, vaccination has commenced even though there's been no official launch.
It's better for us to prevent ourselves. I just take this vaccine for prevention. You know, prevention is better than cure. So I have to prevent myself as well, and I advise my parents to come and do it again.
As of today, we have about 62 people who are vaccinated. It's very safe.
Health workers feel government must increase sensitization of influential groups for the vaccine to be more readily accepted.
Over 10,000 persons, including frontline health workers, political office holders, security personnel and others, have been vaccinated in Adamawa State. According to the state's primary healthcare development agency, 106 vaccination centers are administering the vaccine across the 21 local government areas in line with their population and facilities.
About 10,000 persons have so far been immunized with the COVID-19 vaccine after the 59,000 doses deployed to Adamawa State. The COVID-19 AstraZeneca vaccines deployed to the state started with frontline workers such as health workers, political office holders, security personnel, among others. According to the Director, Immunization and Infectious Disease Control, vaccines have been allocated and deployed to the 21 local government areas of the state. Adamawa State has 106 vaccination centers already administering the shots. One of the frontline workers who took the shot a few days ago shares his experience.
I actually faced a mild headache and a kind of dizziness, but 48 hours after, I bounced back to my feet again.
At one of the centers in Yola North local government area within the Adamawa State capital, officials are here to attend to the people. The Director, Disease Control and Immunization in the Adamawa State Primary Healthcare Development Agency speaks on efforts to get to hard-to-reach areas.
We distribute to almost all the local government areas in Adamawa State. And from the local government headquarters of each local government, it will be deployed to a place we call the vaccination site.
The state health officials say they are looking forward to a smooth deployment of the vaccines, as well as overcoming prejudice associated with it.
Dr. Stephen John, Incident Manager, COVID-19 Emergency Operations Center at Adamawa State, joins us now on the program via Zoom. Thank you for joining us on the program.
You're welcome.
I understand you are, of course, reaching us from the nation's capital, but give us an idea of the situation in Adamawa State and the attitude towards the rollout of the almost 60,000 vaccines received.
Thank you once again. As you have said, over 59,000 vaccination doses have been received by the state, and distribution is ongoing across all the vaccination centers, of which you have 106 of them. And right now, every morning, healthcare workers from these centers go to the local government capital to collect this vaccine from the cold stores and take them to these centers where the vaccinations are going on. But so far, what we've seen is that there's a lot of response from the people. Lots of people are coming out, but the challenges that we face now is the issue of registration online, which is required to generate this particular number that is needed at this particular center. So, but we're trying to see how we can go around this so that we can cope with the number of people coming out. Unlike the COVID-19 response from the beginning, where we had a lot of this negative thoughts from people about denials and beliefs and misconception, this is not the case now, despite what is going on in the social media and in international media also about the side effects of the vaccine. Yes, people sometimes ask, but we clear the air on it, and then we are happy with the response so far.
It's also interesting to note that, a state like Adamawa, for example, has barely 1,000 confirmed cases, looking at everything since the beginning, and now vaccines are also coming in, and you've received this sum. Looking at perhaps, the things that are in place in terms of the citizens, would you say that it's a case of less infection transmission, or that the behavior there, a lot of people are indeed following the non-pharmaceutical interventions?
Well, I think it was a good strategy for the leaders, these strategic leaders, to come out openly to take this vaccine. And also the frontline healthcare workers have been quite busy disseminating information to counter all kind of factors that will stop or serve as barriers to people from coming to this particular health facilities. So all this came together to facilitate the kind of patronage that we're receiving now at this particular health centers. It's not that infection is not ongoing. We know infection is ongoing. As you've said, we're closing down on 1,000 now, the cases that we're finding. And we know already there are indications for a long time now that community transmission is on. But with support from our key partners, government has been able to disseminate information through town announcers, community leaders, local government chairmen, political heads, even before this exercise of vaccination started. So all this prepared the ground for the kind of support we are receiving from the general population by coming out to actually take this vaccine.
In just a few seconds, tell us about IPC measures, which are also key in the inoculation. Are healthcare workers adequately trained? And this is also to be able to intimate those who be vaccinated some of the common side effects of the vaccine.
Yes, IPC is one of the most important pillars in the EOC, the COVID-19 response, and they have been supported, working in partnership with UNICEF and WHO. And health workers in hundreds have been trained. And then also, of course, they are the ones that also train these town announcers and these community leaders that I'm talking about. They bought also a public address system, close to 1,000 that has been distributed across Adamawa. all the wards. So activities are going on, activities targeting this risk communication, not to mention even use of public address system, caravans, all these strategies to reach out to the population, the generality. So everything has been going on well, and we thank our partners for this particular support. And this also, we can see the result from how people are really coming out. Because honestly, we're really happy with the way the exercise is going on at this point in time.
We'd like to appreciate your time on the program, Dr. Stephen John, Incident Manager, COVID-19 Emergency Operations Center, Adamawa State. Thank you for joining us on the program.
You're welcome.
The World Bank Group Global Director of Health, Nutrition and Population, Mohammed Alipate, says the delivery of COVID-19 vaccines to developing countries is offering a light at the end of the long tunnel of the pandemic. He notes that over the last couple of months, the bank, together with WHO, UNICEF, Gavi, and the Global Fund, has focused to help countries get ready to deploy the vaccines.
Are now being delivered. I think it's good to see that vaccines are now being delivered to several developing countries over the last couple of weeks. I think that's offering a light at the end of the long tunnel of the pandemic. And this is happening in an unprecedented manner as well. So the global cooperation around development of vaccines and deployment of vaccines, I think, has worked. And I think the bank has also contributed tremendously in helping its clients get ready over the time that is ahead of us to ensure that people are not left behind. So over the last couple of months, I think we've focused as the World Bank, together with WHO, UNICEF, Gavi, Global Fund, on an effort to help countries get ready to deploy the vaccines, to understand where they are, to assess their readiness to be able to deploy those vaccines efficiently, effectively, as well as equitably. Based on that assessment, over the last couple of months, across more than 128 countries, we know that many countries are ready in terms of the coordination and management of the deployment, in terms of even some of the cold chain infrastructure, the financing, the regulatory bit. But there are some gaps.
Now, while Germany, France and several other European countries have decided to lift suspensions on the Oxford-AstraZeneca coronavirus vaccine following safety guidance from the European Medicines Agency, Germany weighs longer COVID lockdown amid exponential rise. German health minister has said that rising infections mean it may be impossible to ease restrictions in the coming weeks. Health authorities say highly contagious variants have driven up case numbers in the EU's biggest country, which is entering a third wave of the disease. Deutsche Welle correspondent Chelsea Dulani joins us now from Berlin. Hello, Chelsea. European health officials had been warning of a third wave of infections, and it now appears to have arrived. Give us an overview of what the situation is on ground there.
Well, the third wave does seem to have officially arrived here in Europe. European nations have seen infection rates climb over the past several weeks, but it seems to have spiked over the past several days. Here in Germany, the Public Health Agency has reported nearly 20,000 new infections in the past several days. That's the highest rates we've seen in daily infections since January, and they warn it's likely only going to get worse in the weeks ahead. We've also seen healthcare systems in countries like France and Eastern European countries become increasingly overloaded. So this is going to put more pressure on governments to increase restrictions, to re-enter lockdowns. We've already seen, for example, France and Italy put parts of the country back under lockdown. Here in Germany, officials had actually been easing restrictions over the past several weeks, but they are expected to meet next week to discuss the lockdown.
So the ruling from the European Medicines Agency on the safety of the AstraZeneca vaccine after several countries suspended its use, how is that decision affecting countries in Europe?
the decision yesterday from the European Medicines Agency that the AstraZeneca vaccine is safe has given the green light to countries in Europe to resume use of this vaccine. Already today, Germany has started once again vaccinating people with AstraZeneca doses. France, Italy, Spain will also either today or in the coming days begin using those doses once again. The big question is whether these countries will be able to make up this lost time they've lost during this suspension. Germany says that they think they will be able to. They've already started giving those doses to people who were scheduled for appointments during the suspension. So they say this shouldn't have a long-term impact on the vaccination timeline. They still are convinced they will be able to vaccinate or offer vaccines to the majority of the population by the end of summer.
And Chelsea, the EU laid out its plans to create a digital vaccination certificate by summer that could enable the reopening of travel. How would this work?
So the certificate would show if someone has received a coronavirus vaccine, but also if they've recently had a negative coronavirus test or if they've had the virus and recovered from it. It would be accepted throughout the EU, and it would hopefully allow for a resumption of travel within the bloc. It's being pushed for by some of these very tourism-dependent European countries like Spain and Greece, but it hasn't yet been decided what exactly the vaccine certificate would mean. Some countries like Germany and France say it would be unfair to allow people who've been vaccinated to travel without any sort of restrictions, because many people within the EU haven't received a vaccine, likely won't for months, and some people won't take vaccines for example, religious or other health reasons. So there is a concern that this would allow for discrimination between people who've been vaccinated and people who haven't. But the EU has said they will develop this certificate hopefully by the summer. It just remains a question of what exactly that will allow people to do once they have it.
EW correspondent Chelsea Delaney, thanks for that update. Now, the UK's latest R number is estimated to be between 0.6 and 0.9, according to government figures. This shows the average number of people each person goes on to infect, and when below 1, it means the COVID epidemic is shrinking. The UK saw 7% more deaths than normally expected during 2020, according to the Office for National Statistics. Let's find out more in the Global COVID-19 Update report.
21 million people in 16 areas of France will go under a limited 4-week lockdown from late tonight to fight off a third wave of infections. Non-essential shops will be shut down, but schools and hairdressers will stay open and outside exercise will be allowed within 10 kilometers of your home. In the meantime, the French government says there is no reason for France to reject the AstraZeneca Oxford University COVID-19 vaccine. France has resumed use of the vaccine a day after the European Union's drug watchdog said it was convinced that the shot's benefits outweighed any risks. The French Prime Minister is one of the first people to receive the jab following the resumption. Meanwhile, several European countries, including Germany and Italy, have also resumed using the Oxford AstraZeneca vaccine after regulators found no evidence it causes blood clots. Over in Germany, Health Minister Jens Spahn says he would be in favor of signing a national supply deal with Russia for its Sputnik V vaccine for COVID-19. He also dampened hopes that further coronavirus restrictions will be lifted soon, saying rising infections could mean that curbs to slow the spread of the virus may have to be reimposed. The Philippines have approved Russia's Sputnik V vaccine. The country, which has been fighting a recent spike in cases, is set to receive the first batch of the Sputnik V doses in the first half of April. Hungarian Prime Minister Viktor Orban says the country's health system is coping with the record wave, but restrictions would have to stay in place. He says the first stage of reopening will start once 2.5 million people out of the population of 10 million have been vaccinated. Currently, 1.5 million have been given a jab. And finally, India has reported its highest number of new daily COVID-19 cases in 3 months. The majority of the 39,726 new recorded infections came from the western state of Maharashtra, which accounted for 65% of the cases.
The weekend is here, but by no means a reason to let down your guard. Continue to take responsibility. You can visit our website. It's channelcv.com for more updates, a better understanding of the pandemic. You also find several other stories from Africa and the rest of the world. That's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.